Good afternoon. I'm Amy Bouton, Public Information Officer for St. Tammany Parish Government. We're here to give you a COVID-19 update. Today's Thursday, April 16th, and we're here as always with Parish President Mike Cooper. Thank you so much for taking time to give us this update today.
I'm glad to be here to give an update to our citizens.
Good. So we have a lot of topics that continue to come up, and we just want to address those topics and make citizens aware. So we get a lot of questions about our hospitals and what capacity are they at and how they're functioning. And I know that you specifically are in constant contact with the hospitals among the many other agencies you speak with on a daily basis. So can you just give people an update on what's going on with the hospitals, their status?
Certainly. We're so fortunate to have the presence of 4 particular hospitals in our parish that are serving our citizens during this time. St. Tammany Parish Hospital, Lakeview Regional Medical Center, Slidell Memorial Hospital, and Ashton North Shore Hospital. These 4 hospitals particularly are set up to accept patients that have been diagnosed with COVID-19, and if need be, they are hospitalized. Not all positive cases are hospitalized, but if need be, the patients are hospitalized, and our hospitals have been able to keep up with the need of our citizens. And that's particularly because our citizens have taken and heeded the cautions of social distancing and avoiding large crowds, and doing all the things necessary to prevent receiving the COVID diagnosis.
And so our citizens have helped to kind of lessen the burden, as you've been asking since the beginning. So I guess that we predicted that there could be, there's always a prediction for the worst case scenario, the best case scenario, and what we can do to sort of ensure that we don't hit the worst case scenario.
Absolutely.
So in speaking to the hospitals, what would you say as far as the capacity that they have right now? Well,
that's a great question. Based on early models, it was felt that our hospitals would meet maximum capacity and have to go to Tier 2 hospitals and other facilities to accommodate patients either recovering or from the COVID diagnosis. But fortunately, because our citizens have taken the precautions, our hospitals in general are about at 55% capacity, which means there's about 45% additional beds and equipment available in the event there's a spike in cases. So fortunately, we are complying with the requirements and the mandate to stay at home and to flatten the curve so that we do not impact our hospitals.
So they're in really good shape. That's good news. So is there anything else you want to add about the hospitals? I know that the hospital workers, the frontline workers, they're all engaged in this fight with us. So
absolutely. I don't miss the opportunity to thank our healthcare professionals and what they do on a daily basis to serve our citizens. I know that they're working long hours, extra shifts, both in our hospitals, clinics, and nursing homes and assisted living facilities. We've got professionals that are taking care of our citizens, and we can't give enough thanks to them at this time.
So let's talk about what we can keep doing as residents of St. Tammany, and what we're expected to adhere to the stay-at-home order. We've already talked about getting essentials, shopping with one person once a week, one cart, if you can do it that way. Not everyone can, but that's one of the recommendations. But the CDC came out in early April and said, it's a good idea if people start to mask when they have to go into these public settings to protect themselves and to protect others. So what are your thoughts on wearing masks?
Well, absolutely. I have taken the task of wearing masks when I go out as well.
Right.
I want to urge our citizens to exercise this opportunity because it will help slow the spread in addition to the other precautions that we've been giving. So we will be promoting from here on out to urge our citizens to wear masks. We'll urge our stores, the employees who work in the local supermarkets, the drugstores, and any places that are open for business, for their employees to wear masks as well if there's going to be close public contact. So I think here on out, even when the stay-at-home order is lifted, I believe we're going to be seeing a lot of masks out in public, and that's going to be a necessity to help maintain the low numbers that we have.
Okay. So you did mention the stay-at-home order. In the extension that you recently did until May 1st, you did put some additional measures in there for stores, which we talked about already, but we can kind of briefly touch on that again, and that is just requiring or asking stores to set those distances and capacity for the stores, letting certain people, a certain number of people in at a time. And how has that been received as far as you know?
It's been well received. When I make a visit to the supermarket once a week, I have noticed that the blue striping is marked on the floors, showing 6 to 8 feet spacing.
Right.
Dispensers are at the entrance and exits of the supermarkets and retail stores, so that people can disinfect their hands coming in and going. So these are measures that, again, I believe will take place now and into the future as we go in the weeks and months to come towards recovery, that we're going to have to continue doing the things that we're doing now to be able to restore to some type of normalcy and to stay healthy.
So speaking of that, sort of talking about, looking to the future, we're always talking about what we need to do today, right now, what we've done so far, and you're always thinking about what the next step is. So can you tell people what's going on as far as planning for the return to things slowly back to normal?
We do. We have to plan for our next step. How are we going to bring our own employees back here to Coop Drive and to our offices around the parish, so that we can continue to serve our citizens as we're serving now remotely for the most part. We want to have a plan of bringing our employees back, and our staff, my executive staff, is working on that type of plan right now so that we can have that. And we want other businesses to prepare for that as well. We know that I'm going to be working with our business leaders, our business community, and other elected officials, our medical professionals, to build a task force to be able to address a plan so that we'll have a transition into opening up our retail stores, our other businesses that have been closed due to this pandemic, so that we have a plan moving forward.
And I know that throughout this whole process, there's been a lot of collaboration at the parish level, the regional level, the state level, the federal level. So do you want to talk about how you kind of collaborate with the region, the other leaders in the region, and how you guys kind of advocate together going forward?
Absolutely, Amy, and thank you. As you know, I'm on conference calls every day, sometimes more than once per day. And many of those calls are with regional leaders, parish presidents of Jefferson Parish, St. Bernard Parish, Tangipahoa Parish, Washington Parish, and other parishes. We're working together as well to determine a plan, what's best for us, not only for our parish, but as a region, to come up with a protocol for reestablishing reentry into commerce for our citizens and our business owners.
Well, that is good to know. So is there anything else you want to kind of update people on or talk about today, or just kind of give a final message?
Well, like I said, parish government is still working. We're working remotely, and we're devising a plan to bring our employees back so that we can come back to some form of normalcy. We still have infrastructure projects going on at this time. With an uncertainty on the sales tax revenue and other revenues that we have in the next few months, I have deferred the beginning of new infrastructure projects, and I have deferred the major purchases here at St. Tammany Parish government. I believe we need to get a good handle on what our revenue is going to be before moving forward with those projects. But we do have projects in place right now that are in progress. As you know, the construction industry is an essential business at this time,
Right.
and there is a lot of construction taking place right now. And thank goodness that it is, because it's helping to keep the economy moving. I want to work with our business community, our legislative delegation, and all other elected officials through these next few weeks and through the months ahead as we work with our businesses to get started up again, as our citizens get their jobs back again. Our nonprofit organizations are able to have events or activities that can generate funding for the great causes that they provide. So I'm looking forward to working with them in that regard. And I want to urge our citizens, even though the weather is great and it looks like we're maybe getting over the curve
Right.
with the COVID-19, we need to continue doing what we've done before to get to this point, and that is to maintain social distancing, avoid non-essential trips, avoid large social and personal gatherings, wear a mask when you're out in public,
Right.
and do all the things necessary to help us recover quickly so that we can restore our economy, restore our health. And I'm looking forward to working with our citizens to do that. Together we can do that.
Right, if we work together. Well, thank you so much, and thank you again for taking time, which is very valuable to you right now, so we appreciate you taking time for that update. And that concludes our update. We have every update is available on our Access St. Tammany STPG-TV station, and you can also see it at www.stpgov.org on our COVID-19 page. So thank you for joining us.